മൂന്നാം തരംഗം കുട്ടികളെ ബാധിക്കില്ലെന്ന കേന്ദ്ര വാക്സിൻ വിദഗ്ധ സമിതി അംഗം ഡോക്ടർ എൻ.കെ. അറോറ മീഡിയാവണിനോട് പറഞ്ഞു. കുട്ടികളെ ബാധിക്കുമെന്ന് പറയാൻ ശാസ്ത്രീയ തെളിവുകളില്ല. അടുത്ത മാസത്തോടെ രാജ്യത്ത് കൂടുതൽ വാക്സിനുകൾക്ക് അനുമതി നൽകും. ഡിസംബറോടെ 18 വയസ്സിന് മുകളിലുള്ള എല്ലാവർക്കും വാക്സിൻ നൽകും. കേരളത്തിൽ രോഗവ്യാപനം കൂടാൻ കോവിഡ് നിയന്ത്രണങ്ങളിലെ ഇളവാണ് കാരണമെന്നും ഡോക്ടർ എൻ.കെ. അറോറ മീഡിയാവണിനോട് പറഞ്ഞു. MediaOne എക്സ്ക്ലൂസീവ്.
രാജ്യത്തെ വാക്സിൻ വിദഗ്ധ സമിതി അംഗവും ശിശുരോഗ വിദഗ്ധനുമായ ഡോക്ടർ എൻ.കെ. അറോറയാണ് MediaOneനോടൊപ്പം ചേരുന്നത്. കോവിഡ് മൂന്നാം തരംഗ സാധ്യതയും വാക്സിൻ വിതരണത്തെ പറ്റിയും അദ്ദേഹത്തോട് തന്നെ ചോദിക്കാം.
So for the past 2 years, our country is fighting with the COVID pandemic. When will we expect to end the threat of COVID-19 in our country?
So, SARS-CoV-2 is a virus which is evolving several times ever since it was first discovered in January 2020, and thereafter several mutations and has taken. There is another dimension that this virus is giving a type of disease which we have never seen before. In view of all this, it is very difficult that when we will get rid of this virus, or in the long term, in the coming years, what will ultimately happen, it is very difficult to say.
Sir, we have already been introduced to 2 vaccines, Covishield and Covaxin. Do you think that they are safe and effective to prevent the Delta variant?
Both these vaccines are safe. 65 crore people have taken without any side effects, even though new variants keep coming. Initially, so-called effectiveness, there may be difference, but in terms of severe disease and death, both these vaccines are as good as any other vaccines in other part of the world.
Sir, if more vaccines get approval, how much time it will take to the complete vaccination in our country?
I hope you are already aware that Sputnik is also being manufactured in India. Another vaccine just about 10 days ago has been approved for emergency use authorization, that is Zycov-D. This is world's first DNA vaccine. This vaccine will be introduced into the program in October 1st or 2nd week. In fact, there are already 8 or other 10 other vaccines. So India will be one of those countries where maximum number of vaccines will be available. Now the second question you have asked, whether we are going to immunize all our adults by the end of this year. So 65 crores we have done this month, and we have 4 more months. We have a total population of 90 crores or so, for which we need about 180 crores. So our major bulk suppliers during coming 4 months are going to be Serum Institute and Bharat Biotech, that means Covishield and Covaxin. The whole focus will be that we should have around 180 to 185 crore doses by the end of the year. The country has witnessed that we are able to give up to 1 crore doses in a day. So you can just imagine that whole Kerala can be immunized in 3 days. We have 3.5 crores or something of that kind population in Kerala. So we will be able to immunize our adult population by the end of this year.
Sir, you are a pediatrician as well. There are reports that children are vulnerable to expected the third wave. Is it factually clear?
So repeatedly, not only me but others have also been saying that God is kind to children. The virus has certain characteristics that it is not able to infect children and cause disease. So the recent Sero survey in India has very clearly shown that the proportion of adults and proportion of children who have been exposed to virus or infected are similar. But the disease, even mild disease, is uncommon in children. Severe disease and death is extremely rare. So this is both from India as well as from outside. Within India, first wave as well as second wave. So there is no reason to believe that children are more likely to be affected. Notwithstanding this fact, the government has already made plans to strengthen our preparation for managing children. From epidemiology, from science, from past experience within the country, I would assure all parents that children are unlikely to be affected disproportionate to adult population or what is there in the past.
So as we know, Cydus Kerala Psychov conducted clinical trial in 12 to 17-year-old children. So when will we start vaccination in children?
So that's a very good question. Zycov-D is now India's first vaccine, which is also approved for 12 to 17, the adolescent age group. However, within that population, we have a population of 12 crores. And overall, below 18 years, we have population of 44 crores. Obviously, and as I said, the disease in children is very mild or not at all. It's asymptomatic. Similarly, for children, we are going to make a list of 12 to 17-year-old who have comorbidities, and this list will be made public and before Zycov-D is launched, so that the preparations are made to identify these and the vaccine can be given to them.
We can come to Kerala. Comparing to other states, Kerala shows a increasing trend in COVID cases. Can you portray any reasons?
After the second wave, Sero survey showed just around 40% people were affected in Kerala, and 60% were left susceptible or vulnerable to infection. This is in contrast when we look at the whole country, rest of the country, about 70% were affected, 30% were susceptible. So the pool of susceptible population in Kerala was very high, and virus was still circulating. I think the permissions to organize social gatherings, the religious or political or otherwise, right from starting from Eid and then coming to Onam, and then we have these boat race. So all these have been organized, and principles of social distancing were not followed strictly. The second is, I think, testing and then tracking, home quarantine and containment. These are things which need to be done more effectively, so that we don't have to have a blanket lockdown in whole of Kerala. Smart containment and lockdown approach has to be done at district, sub-district and even small parts of the same city. The community also has a great responsibility that they should follow the community corona appropriate behavior. People from Kerala have a very good health habits of seeking care early, and it has a very good health infrastructure. But last couple of weeks, we know that the mortality has started rising. So I think these are very worrying situation, and some kind of containment and lockdown is required for that.
So my final question, some study reveals that the mixing up of Covaxin and Covishield is effective to resist COVID-19. Is it dependable?
So the one study has started in India for mixing and matching Covishield and Covaxin. In CMC Vellore, they have started a study. Mixing and matching studies are not for saving the vaccine doses, but it is primarily to see whether we get a better immune response and an immune response which lasts for a longer period. But till we have good evidence within the country, I would very strongly suggest that nobody should try mixing, because some platforms, there is some initial that if you mix up two vaccines from different platforms, they are manufactured on different platforms, it can increase the reactogenicity. And so we need to be careful. Till scientific evidence is there, we should not do that. Here, I would also like to compliment Kerala that the vaccine use has been tremendous. Over 2 crore doses have been given. Almost 80 lakh people have received 2 doses. That's very good. But the example of we are seeing that whether it was Israel or USA, even though the background immunization rates were high, but when they let their guard down as far as corona appropriate behavior from individual and societal perspective, they are facing a lot of difficulty. I think Kerala, as there is a lot of lesson to learn from that, and issues of this corona behavior is very necessary.
Okay, sir. Thank you.
Thanks very much. Such a pleasure to be with you.
താങ്ക് യു സർ, താങ്ക് യു. രാജ്യത്ത് ഡിസംബറോടെ 18 വയസ്സിന് മുകളിലുള്ള മുഴുവൻ ആളുകളെയും വാക്സിനേറ്റ് ചെയ്യാനാകുമെന്നാണ് ഡോക്ടർ NK അറോറ പറയുന്നത്. ദില്ലിയിൽ നിന്നും ഷംന അശോക്, മീഡിയ 1.